Hey everybody, I am sitting with one of my favorite doctors in town, Dr. Agatep. Thanks for doing this.
You're welcome.
We were just having a great conversation about COVID-19, some preventative measures and things people can do. But he and I thought it would be a good idea just to let you know that we work together on a routine basis. Anything with co-management of patients that is going to benefit you, or obviously with your approval, if we can give you a collective approach chiropractically and medically. He and I have done this for years, but we just want to let you know in some crazy times, we'll be more cohesive in our message and what we can do. And there's also some lifestyle things that maybe it's a good time to talk to your kids or have a family discussion about that would be preventative in lieu of all this, that going forwards, maybe you live a healthier lifestyle coming out of it. So Dr. Agatep, thanks for doing this.
You're welcome.
But also let's go through some of the list of things. That's a short list, but things that people can change that are known as comorbidities or lifestyle behavioral things that would be good for people to get rid of as far as a healthy routine.
Yeah, well, this is a great opportunity, of course, to make some changes for positive health and going forward. We know that a majority of the patients who suffer really bad complications from coronavirus infections have comorbidities, right? Which is high blood pressure, diabetes, asthma, COPD, obesity. Those tend to be factors that seem to actually predict poor outcomes when you get infected with coronavirus. So I've been advising our patients to take this opportunity to really get yourself back into good health and to get rid of behaviors that would really put you at risk for dying, and hopefully that those behavioral changes stick going forward. Especially you mentioned smoking, it's a big one, and of course vaping as well too. That probably there is evidence now that shows that even vaping itself might be contributing to the poor outcomes that Americans have been having when they're infected with coronavirus. The lack of exercise, and of course, with social distancing, exercise is hard, but there are a lot of opportunities now that a lot of our streets and our neighborhoods are wide open most of the time. Maybe taking that opportunity to go out there and get active. And of course, there are also a lot of health promoters out there online that you can watch to do home exercises as well.
Absolutely.
Taking this opportunity to eat healthy, right? So I'm always a big proponent of eating up mostly a plant-based diet with lean meats and healthy fats in there. And using this opportunity to actually cut down on processed foods and cut down on processed sugar as well too. Also another opportunity to get 8 hours of sleep.
And that doesn't mean 4 hours here and 2 hours there and 2 hours. It's 8 contiguous hours of sleep is really what the body needs.
Yeah, there's a lot of data that shows that's kind of how evolutionarily our body is built. The amount of people who can sleep less than 6 hours a day is actually less than 1% of 1%.
Right.
So those individuals are very rare. Everybody does need their 8 hours of sleep.
I love it. So at Glowaki Chiropractic, we've had a great relationship with the medical doctors here in town. He's by far one of my favorites, and just has always been super gracious about giving public service messages like this. But some of the things like vaping, we base a lot of our recommendations on science and research, and I love to say what the research shows is this, but just candidly, we were just saying, hey, look, you don't want to wait until the research is there to strongly discourage vaping. Just use some common sense on this one. It's kind of new to the market, which means there's not a lot of research for longevity on this, but it's not a good time. When COVID-19 is a lung-based infection, that's really where some of the symptoms show up in a big way and compromise other systems of the body. Just use some common sense, don't do that. I love the recommendations on comorbidities. What that means is diabetes and high blood pressure. And what you'll hear in the media is comorbidities. That just means your body's not healthy to begin with, simply put. And then when and if you get exposed to this virus, and should you become infected, the outcome isn't good. What he's being polite about saying is that's when the risk factors go through the roof. So take this opportunity, take it as a warning sign that you need to clean up your health, you need to get active, and we always say be hard to kill. Keep your immune system healthy, so no matter what you come in touch with, the idea is your body's strong as you can make it, and no matter what your conditions are, there are variables in your control.
Yeah.
Right? We also talked about hydration. was one of those as well. Just staying properly hydrated. To be clear, that doesn't mean Gatorade, right? I get asked that a lot.
Yes.
Is Gatorade better than water? No, water's the best. High fructose corn syrup and Gatorade's not good for you. So we'll do some other tips like this, but if this helps out, comment down below. This is Dr. Elmo Agatep. He's a dear friend. They've got some phenomenal medical doctors right here in Seal Beach. And thanks for being on the front line and helping so many people out.
Yeah, you're so welcome. Thank you.